Hi, my name is Audrey, and I have my mentor, Patty, here, who is an LVT. She is going to be monitoring and mentoring me today while I do my anesthesia video. I have my patient here. This is Benny. He is a 4-year-old male neutered black Labrador retriever. He is here for a grade 1 dental procedure. I made sure that I have Benny's chart as well as the Nova anesthesia monitoring sheet, and all of my drug calculations have been prepared and approved by my mentor and my DVM, and I will be submitting those at the end. Benny is 71.4 pounds today, and his pre-anesthetic vital signs are a temperature of 101.8, which is within normal limits, a heart rate of 112, respiratory rate of 40, and CRT of less than 1 second. He was pink, which is all within normal limits. He is classified as an ASA 1 patient, and his pre-anesthetic lab work that was performed today, he had a chemistry and CBC done, which were all within normal limits. And this was all checked by my mentor as well. As far as pain management plan, I did discuss this with my mentor for this patient since he has a grade 1 dental with no extractions anticipated. No additional analgesics or local nerve blocks or take-home pain medications are required, but I will submit at the end if he were to have extractions what the protocol would be. Next, I'm going to go into the preparation prior to the procedure. I begin by checking the oxygen tank, which is an H tank, to ensure there is adequate oxygen supply for the procedure. Everything looked good here. Next, I confirm that the active scavenging system is turned on to safely remove waste and anesthetic gases. I am also ensuring that I have my personal protective equipment on, which includes my surgical cap with no hair poking through, my mask, my stethoscope here, my surgical scrubs that I'm wearing, my surgical booties, and my watch here that does count secondhand, and also gloves and goggles since we're doing a dental procedure, just to maintain both patient and staff safety. And then I also have my clipboard with my anesthesia monitoring and the patient information. Here I'm going to be demonstrating how I assemble and check the anesthesia machine and the ventilator system. So this is our ventilator here. I am going to be attaching the oxygen line here and the active scavenge line. I am going to connect those two lines, then perform a leak test by setting up my tubing here, attaching inhalation and exhalation tubes and the isoflurane tube. I'm going to hook those up, make sure everything is tight. And I am also checking and making sure we have adequate levels of our anesthetic gas, which we are using isoflurane. So I'm going to occlude the patient end of the tube, turn on my ventilator, and do a leak test. And it'll tell us if it passes or if it notices any leaks, and it passed. I then am going to confirm that all the monitoring equipment is functioning properly and ready for use. So first I'm going to check my capnograph. So this is good for end tidal CO2 monitoring, and everything is working properly. And I also check my blood pressure monitor with the appropriately sized cuff for our patient. And I am also going to ensure that our ECG machine is turning on properly and our patient is set up in the system with their proper weight in kilograms. I'm also checking, making sure our ECG leads are working properly, there's no damage. I also am getting a SpO2 monitor, which is going to check for oxygen saturation levels. And I am also showing here our esophageal stethoscope to monitor for continuous heart rate. For our dental procedure, we will just be using a regular stethoscope. I am then going to set up the fluid pump and prime the fluid line with lactated ringer solution, ensuring that there are no air bubbles present. For Benny, for his weight, the intraoperative fluid rate is set at 214 milliliters per hour. And then we do keep them on post-op fluids for a protocol of our hospital, and we half the rate. So his post-operative rate will be 107 milliliters per hour, and we're going to have him on that for 2 hours. I also double checked that our heat support is working properly, and we are using a chill buster for today. I did get my drug calculation checked by my mentor. For pre-medication, we are using butorphanol and dexdomitor, and for induction, we are using propofol, and I will include the calculations at the end. I made sure to gather necessary supplies for induction and intubation. I got 3 endotracheal tubes, sizes 10.5, 11, and 12 millimeters. Each tube was checked for leaks and defects prior to use. I also have a laryngoscope, cuff inflator, tube ties, and lubricant. Additionally, I also prepared supplies for IV catheter placement, including clippers that I did check for any debris, sterile saline and diluted chlorhexidine scrub, and a 20 gauge IV catheter, which is appropriate for his size, some bandage, tape, and additional flushes, as well as a T-port. I also ensured that we had eye lubricant for the patient as well. Here I'm just showing again in our dental area our proper PPE is on. We have our gloves here as well as our goggles. And I just wanted to show my setup over here. I have my clippers, my proper sterilization cleaning materials. I have my tape, my tubes that were already checked, my laryngoscope, and proper lubricant and tie. And again, I have my catheter supplies, my T-port, my 20 gauge catheter. We also have our dental prophy angle, our paste, and our SpO2 monitor. And here I'm just ensuring that I have the anesthetic monitoring paper here, the chart, and setting his ventilator for his proper kilograms. And my mentor is checking behind me. I'm also just ensuring that the vaporizer is still full and that we have everything properly set up. Here I'm just setting his fluid pump to 214 milliliters per hour, and my mentor is double checking behind me. And I'm going to prime that specific fluid bag, which is LRS, making sure that there's no bubbles present. And now that fluid pump is ready to go. Next, we are going to pre-medicate our patient. So Patty is going to be restraining him for me. We're going to make sure he's nice and comfortable. We're just confirming that his pre-medication dosing, and we have the correct chart here, are all correct. And Patty is confirming that for me. And I do have his injection here, just confirming that everything looks good. And Patty is going to restrain him for me here, but first I'm just going to listen to his heart and lungs. And the doctor has already pre-examined him as well and listened to his heart and lungs as well. Now Patty is going to make sure she has a good hold on him, and I'm going to palpate his muscle area here prior to poking. I'm going to poke him in his right rear hamstring muscle. I'm going to go at a 90-degree angle, aspirate back to ensure that we're not in any vessel, and inject and make sure that the patient is nice and comfortable, and do a one-hand capping method of my needle. I did record in my chart where I premedicated the patient and at what time. Now that he is adequately sedate, we are going to make sure that he is hooked up to an SpO2 monitor and I am going to listen to the patient prior to placing an IV catheter to make sure that there were no adverse effects of pre-medication, and also verifying his vital signs are nice and stable. I am ensuring that Benny is nice and comfortable, and I am going to now prep for the IV catheter placement using aseptic technique. First, I'm going to clip the site and surgically prep it, ensuring that there's no hair left behind. Next, I'm going to palpate the vein, and then I'm going to aseptically scrub the area using sterile saline alternating with dilute chlorhexidine in circular motion, starting from the inside and then outer. And I did prime my T-port with my flush, and now I'm going to attempt to place the IV catheter. This attempt was unsuccessful as the vein started to blow, so we did apply a Band-Aid and switch over to the right leg. I did lubricate Benny's eyes now, and I did listen to his heart and lungs again. I then prepped his right leg just like I did on the left, where I'm shaving away any hair. I then am aseptically scrubbing the site as well. As same as before, I'm using sterile saline and diluted chlorhexidine scrub and alternating and going in circular motions and doing 3 of each. And I had already palpated my vein prior to doing that. I next making sure that my T-port is primed and my catheter is ready for placement. Once I have a flash of blood, I advance the catheter into the vein, and I am going to put the end of the catheter tip to block that in the port there, and then I'm going to use my tape to secure my catheter in. Next, I'm priming my T-port and attaching that, and flushing the catheter to make sure that it's flowing properly. And then I'm going to tape my T-port in. I am also ensuring that I am quickly and adequately documenting this as I go in my chart. And next, I will be administering Serenia. We give this to all of our surgical patients, so I am giving this IV, and I did confirm the dose with my mentor. After I give that, I am going to flush that with the sterile saline and record that as well. We are also keeping an eye on Benny's vitals and his anesthetic depth, and here I'm measuring for his tube, and as far as length, checking to his thoracic inlet, and making sure that I have his tie and the proper supplies to intubate. Next, I'm going to pull up his propofol, since I did check his depth of anesthesia and he is at a good depth. but does need some propofol in order to intubate. We pulled up 6 milliliters, which was double checked by my mentor, and I am listening to him prior to giving this via his IV catheter. And now that I've ensured everything sounds okay and he is stable, I'm going to administer that slowly to effect. I do flush that with sterile saline, and now that he's been given his propofol, I am going to listen to him just to ensure that everything still sounds good and he is still stable. And next I'm going to check his depth of anesthesia and make sure he has no jaw tone, no swallowing or palpebral. Next I am going to use my laryngoscope to intubate him, which my endotracheal tube did have lubricant on it. And next I'm going to ensure that that is in, and my mentor did double check behind me, and I am tying that in with the tube tie here and making sure that I am not making it too tight or too loose here. And next we're going to hook him up to oxygen, lay him laterally. Usually we would cut the tube to prevent dead space, but we do not do that at my hospital. Next, we're going to check for any leaks and only inflate the cuff as necessary, as we are both listening here to ensure that there are no leaks. And I also did turn his isoflurane on his vaporizer, and well as charting this as well, and making sure that his IV fluids are hooked up. I am hooking those up here and getting his monitoring equipment on. His ECG, his capnograph is already hooked up, and we have his SpO2 that is already reading, and I'm just going to ensure that I am putting these in the proper limbs, which the white is going on the front right limb, the black is going on the left front limb, and the red lead is going on the left hind limb. I am also ensuring that I'm hooking up our blood pressure cuff, as well as getting our temperature probe set up, which is also done rectally. I also made sure that our heating equipment was working, and we do have the chill buster here, but we also do put a towel on them as well. I am making sure that the ECG looks okay on the monitor and all of his vitals are normal and his capnograph is working properly and his SpO2 is working, and I am also going to be listening to him every 5 minutes, counting for 15 seconds for heart rate and for respiratory rate and multiplying it by 4. And making sure that I am also checking his pulses as well as his depth of anesthesia, checking his palpebral CRT every 5 minutes, and ensuring that his levels on the ECG look normal as well. I have also ensured that everything is working properly. His heating equipment is still working properly, which is the chill buster, and that I am charting and documenting his vitals every 5 minutes. Any abnormalities would be addressed promptly and communicated with the team to maintain patient stability throughout the procedure. Benny's vitals are very stable throughout the procedure. Next, we are going to flip Benny onto the other side to start cleaning on that side. So I am disconnecting him from his monitoring equipment and his ventilator tube. We are ensuring that his mouth and his airway is guarded while he still has the endotracheal tube in while we flip him, and I'm going to immediately hook him back up to oxygen and ISO and get him back on his monitoring equipment here. We have now finished with Benny's procedure, so we turned off his isoflurane. He's going to be on oxygen for a few minutes, and then we are going to disconnect him from the ventilator and see when he starts breathing on his own, and then we will take him back to his cage where I will extubate him. I'm going to continue taking Benny's vitals and keeping an eye and making sure he is stable while he is waking up. And now that he is breathing on his own, we're going to take him back to his cage. I now have Benny in his post-op cage. I'm going to make sure he's nice and comfortable, hook him back up to his fluids, which we have halved his rate of his post-operative fluids. He still has his endotracheal tube in. We're going to wait for him to swallow about 2 times before we want to take that tube out. And I'm just going to take his post-op vitals, check his temperature, make sure that's normal. He doesn't need any additional heat support, and check his heart rate, his respiratory rate, his CRT, his pulses, all of that, and wait for him to swallow twice. All right, here Benny did swallow multiple times, so I'm going to go ahead and extubate him nice and slow, make sure he's nice and comfortable, and then let the doctor know, and we're all done.